My name is Eileen Castillo, and my presentation is high intensity interval exercise versus moderate intensity exercise effects on aerobic capacity in patients with coronary artery disease. Increased aerobic exercise capacity appears to reduce both all-cause mortality and cardiovascular disease. Exercise that increases maximal or peak aerobic capacity is recommended for individuals who suffer from coronary artery disease. Maximal oxygen capacity or peak oxygen capacity is the maximum capacity of the body to transport and utilize oxygen during exercise capacity. The intensity at which somebody exercises can then impact the oxygen uptake of the body. So we know that as intensity of exercise increases, the demand for oxygen to the working muscles increases. So different intensities then elicit a different response to oxygen capacity as measured by VO2 peak. And VO2 peak is an established objective measure for cardiorespiratory fitness and functional capacity, and is a validated predictor of future cardiovascular morbidity or mortality in both healthy and diseased populations. So we know that VO2 peak is the product of maximal cardiac output and arterial venous oxygen difference. So again, this is how much flow is ejected from the heart and how much oxygen is actually metabolized and used by the tissues in the body. So VO2 peak is then used and not VO2 max because a VO2 maximal test, there is a plateau in oxygen uptake that is reached. And for disease populations, there may be a risk to reaching this maximal oxygen uptake. So this is due to arrhythmias that occur within these patients. So then a VO2 peak is a more appropriate value for these patients, which is determined by a submaximal exercise test. So a VO2 peak shows the oxygen uptake attained during the test, not necessarily the highest oxygen uptake value that can be attainable for these patients. So as aerobic exercise capacity seems to reflect a continuum between health and cardiovascular disease and death, it is important to design effective programs for exercise-induced gains in VO2 peak. The most efficient exercise intensity to increase VO2 peak is still lacking. So the aim and purpose of this study was to evaluate the effects of aerobic capacity when intensity is the only factor being manipulated. So methods, a total of 21 patients was in the study, participated in the study, who showed signs of coronary artery disease. So some of the inclusion criteria was an angiography documented coronary artery disease in a major epicardial vessel, stenosis treated with coronary artery bypass surgery, a percutaneous intervention, ischemia in exercise electrocardiogram, and exclusion was left coronary main artery disease, unstable angina pectoris, claudication, myocardial infarction within 3 months, bypass surgery or percutaneous within the last 12 months, any complex arrhythmias, or an ejection fraction below 40%, as well as any orthopedic or neurological limitations that did not allow patients to participate. There's no difference in medication, and each patient started with an initial VO2 peak test using a ramp protocol on a treadmill where speed and elevation were increased until exhaustion. A metabolic cart was utilized to obtain the VO2 peak values. So each patient was attached to an electrocardiogram to monitor for any arrhythmias and to monitor heart rate and blood pressure as well. And heart rate was assessed during rest and each level. of exercise, and the blood pressure was taken as well at each level of exercise and at rest as well and recovery. And rate of perceived exertion was also utilized on a Borg scale of 6 to 10. The VO2 peak was assessed during the first and last visits of the study to track any improvements as these patients underwent the 10-week study. So patients were then randomized into a high intensity interval training exercise program or a moderate intensity exercise program. In the high intensity exercise program, the VO2 peak values were between 80 to 90%, and the heart rate peak was 85 to 95%. And for the moderate intensity group, it was between 50 to 60% of the VO2 peak or 60 to 75% of the heart rate peak. The high intensity interval group then completed a 4x4 minute high intensity exercise at 2.29 liters per minute. And they had a recovery phase of 3x3 minutes at 1.53 liters per minute or 60% of the VO2 peak. The total exercise time was composed of 31 minutes for the high intensity exercise group. For the moderate intensity exercise group, the total exercising time was composed of 41 minutes. So to equate the workloads and having the intensity being the only value manipulated, the following relationship was used. So the total value of VO2 time relationship for the high intensity group was divided by the intensity for the moderate intensity group, giving a total of 33 minutes. This allowed for the same total training load between both groups. Participants knew the heart rate corresponding to their VO2 peak level and were encouraged to exercise at the appropriate level. And a two-tailed test at a p-value less than 0.05, less than or equal to, than 0.05 was accepted as the level of significance for all value. And results indicated that high intensity aerobic exercise is superior when compared to moderate continuous exercise, eliciting a higher VO2 peak value when the final VO2 peak test was assessed after the 10-week training. And so, although there were improvements in both the moderate intensity and the high intensity group, the high intensity group shows a higher response to the 10-week training that patients undergo. The results of the present study may bring new ideas into the area of cardiac rehabilitation with respect to high intensity exercise as being the superior form of exercise for increasing aerobic capacity. Safety is still a crucial factor when prescribing a high intensity training for rehabilitation patients. As we know, these patients are already prone to arrhythmias, and high intensity training can raise heart rate response and therefore almost like agitate or irritate or cause arrhythmias when the heart rate is elevated for long periods of time. So currently, patients are encouraged to perform aerobic exercise for a minimum of 3 times per week for at least 20 minutes of intensity at 40 minutes.